Welcome back to the Minds and Memoirs podcast.
I am Jake Maynard, a third-year student at the University of Texas at Austin, studying business with interest in behavioral economics and mental health.
And I'm Jordy Bach, a rising senior at Wash U in St. Louis. I study psychology, neuroscience, philosophy, and computer science with an interest in mental health.
This is episode 4, about how to help yourself and others when facing mental health struggles. In this episode, we discuss what you can do to help yourself when facing mental health struggles and how to identify and help others challenged by mental health.
To outline the episode, first we'll talk about the ways you can help yourself, including activities, mindful practices, and positive habits to reduce the symptoms associated with common mental health struggles. Then we'll compare and contrast that with how to approach helping someone else.
Then we'll hear from Victoria Fernandez, who has persevered through mental health struggles of her own and has come out the other side with a unique understanding of how to manage and mitigate challenging mental health symptoms. After, we'll talk to Dr. Lara Latimer, an expert in personal health, including meditation, other stress reduction and management techniques to improving yours or others' situations when facing mental health concerns.
Finally, we'll discuss and talk with Dr. Brent Turnipseed, another expert in the field of mental health, about tackling the root causes of mental health problems and hence explore the possibilities around finding long-lasting solutions.
To clarify what we mean by symptom management and reduction techniques, when we talk about how to help yourself and others, we understand that there's a distinction between symptom or sign management, reduction, mitigation techniques, and tackling the root cause of the mental health concerns. Both are important in their own right. While tackling the root cause is more effective in the long-term approach, sometimes we just need to feel better in the moment. And that's where sign management comes into play. We also understand that there can be a difference in how to approach mental health concerns of your own versus how to identify and help someone else around you.
So why are we talking about this? Well, one of the most important aspects of speaking about mental health is talking about how to help yourself or others. These solutions need to be practical, useful, and above all, known by as many people as possible. Understanding the best ways to resolve mental health struggles is the most important piece of the puzzle. It's a big reason for learning about and talking about mental health. We want to understand what a mental health condition is and where it comes from, and now the challenge is how to manage it.
Some examples of management or reduction techniques include meditation, yoga, eating healthier or including different vitamins and nutrients in your diet, turning off or limiting social media or just like the news and other traditional media outlets, connecting with nature, finding new hobbies, a new thing that we like to call pop culture therapy, which we'll discuss in the next episode, changing your environment, writing in a journal or tracking your daily moods or daily achievements and gratitudes, planning a trip or an activity to have something to look forward to in the future, focusing on your physical health, and even things like spending time with a pet, and many more. There are a lot of different management and reduction techniques to consider.
Yeah, so then how to help others? Firstly, identifying potential mental health issues in other people is pretty difficult because you don't have access to the thoughts and feelings of others. Looking for significant behavioral changes, like if they're unusually quiet and withdrawn or have uncharacteristic angry outbursts, is a good start. Also, eating much more or much less than usual is a characteristic sign of disorders like depression, bipolar disorder, or eating disorders. Look for signs of complaints about bad feelings or unexplainable and seemingly random aches and pains. Finally, if you notice this person's relationship with you or with others around them is becoming increasingly unstable, that's a big sign that they're struggling with their mental health.
If you're concerned about a loved one's health, what can you do about it? Well, talking to them directly is the best first step, but it has to be executed sensitively. Plan out what to say beforehand and make sure that you give the person plenty of space to talk. Now, let's go over some do's and don'ts, Jordy, so we can think about how people can approach how to help others with what to do and what not to do. So to begin with, what are some things not to do. I think you definitely don't want to push them to do anything that they're not comfortable doing, right? You have to you can't force anyone to do anything, and you have to allow them to make the decision for yourself. Is there anything else that you think of that you should not do when trying to help someone?
Yeah, a few more are try not to pressure them to stay busy or keep going in their daily routines. It's okay to do nothing sometimes. It's important not to ghost or ignore a person, especially when they're struggling, and make them feel like they're not alone.
Absolutely, and there's other ones like, not to take anything personally when they say anything, and don't personalize their behavior in making them feel like something is wrong with them when really it's the mental health condition that is making them behave the way that they are. So don't personalize their behavior, don't blame or shame. And is there anything else that you have?
Right, their behavior doesn't define them.
Absolutely,
So
right.
it's how their actions aren't who they are. It's not their fault. It's part of the mental health issues they're having.
Yes, and I think one more important thing to not do is to, don't question any of their medical decisions that they've made, and don't make decisions without their consent. I think those are really important as well.
Definitely, yes.
All right, so now let's talk about some of the things to do, right? What to do if you want to help someone. Do you have anything that, on the top of your mind, what you can do to help people?
Well, yeah, so when you want to address someone and start helping them, you want to have a plan from the beginning when you approach them and begin the conversation with an intention, so you aren't just going in and blindly putting them on the spot when you're not sure what you want to say. Give the person space to talk and ask them open-ended questions. It's okay to just sit and listen. You don't have to always respond or affirm what they're saying. And use I statements. Be patient with them. Try not to be judgmental about what they're saying. You have anything else there, Jake?
Yeah, I think some smaller things that you can do, is like little acts of kindness, offering to go, shopping or go with them to professional appointments if they are accepting of that. Finding out what works for them and trying to help them in the little ways that you can, because those little things go a long way, especially when some people feel like they're very isolated and feel like no one is there to help them. But when you do a little thing like that, I think it can go a long way. So I think there's a lot of things to do. There's a lot of great things to do, but being listening and having an open mind, encouraging them to get help, and just being there for them and being that person who can be supportive. And as we'll talk with some of the guests, there's things like being vulnerable and opening up to them about yourself and about other people who have gone through some similar problems that they have. I think those are very helpful. So
definitely. And even finding resources to suggest can be a good way to encourage them to find help on their own.
Yeah, no, definitely. All right. Moving on, we have our first guest speaker for the day. Our first guest is Victoria Fernandez. She has a YouTube channel and an Instagram account called I Live to Inspire Mental Health with thousands of subscribers and followers. And Victoria is a proud mental health advocate in the online community. So we're happy to speak with her. Welcome, Victoria Fernandez, to the Minds and Memoirs podcast. We're excited to hear about your experiences and insights and understanding of mental health, most notably how you've lived or how you've learned to live with mental health conditions. So to kick things off, tell us a little about yourself and your personal experience with mental health and what mental health concerns you've faced.
Thank you guys for having me on this podcast. I I guess a little bit about myself. I'm 24 years old. I studied at Texas A&M, and throughout my time there, I started my YouTube channel. I live to inspire mental health, in which I talk about my experience with bipolar disorder and OCD, as well as like some learning disabilities like dyslexia. And you know, for me, I was diagnosed when I was in high school. I was around 17 years old, but I had experienced symptoms from the age of 7, as far as I can remember. And I decided that, I wanted to make a difference in the world when it came to mental health. I think mental health has kind of exploded, like people talking about it in the recent years after the pandemic. But when I started, I think it was like 3 years ago, a little over that, it's still wasn't being talked about as much. So it was definitely scary to come out to the world and be like, hey, like I have bipolar disorder. But creating this channel has brought for me so many opportunities on my personal and professional life. I think many of the fears were like, oh, I won't be able to get a job if I'm very open about this. But I was able to get a job at Google, for example, because of the different things that I've done. And then I've been able to connect with a bunch of people who have shared their experiences, and we've been able to talk about mental health and lower the stigma, which honestly is my passion, and I hope to be able to do this for the rest of my life.
No, that's awesome. Yeah, I think starting something like that is it's a brave move, like you said. It takes a lot of courage to do that, but the fact that you did and the fact that you've proven that it can be successful and it has actually been beneficial to your life and probably beneficial to many other people's lives. That's really awesome. So going into our next question, how did you begin understanding how your mental health concerns like affected your life?
So I think that from a very early age, I experienced a lot of like difficult things. For a little bit of context, I moved a lot. I'm originally from South America, so from Venezuela, but moved to the US when I was nine years old. Faced a lot of changes in my life. But even from the time that I was living in Venezuela, I experienced a lot of like bullying because I was a very emotional kid. I had a lot of like kind of tics and, little things that, as you guys might know, kids are mean and they
Mm.
pick up on things pretty quickly.
Yeah,
And
yeah,
so
totally.
yeah, I was a pretty easy target. And that was really hard. When I was like 7, I started noticing I started having intrusive thoughts, which are linked to OCD. So there were things kind of like, if you don't do this, if you don't touch the couch or whatever, your mom's gonna die, like things like that, which were very disturbing. And quite frankly, like 20 years ago, or I mean, a little less than that, probably 17 years ago, mental health was like taboo. Nobody talked about it. And that's when I started seeing those effects. But obviously, there was never a diagnosis until way later in my life. I think when I moved, I kept experiencing the same things. I would cry a lot. I would have intrusive thoughts, mood changes. When I became a teenager, I think that's really started hitting because I started, becoming very suicidal, and I didn't want to live anymore. And life was just very difficult. And it was dealing with, high school, being a teenager, having mental health issues, and not really understanding myself until, my parents took me to the doctor and they were like, okay, like what's going on? This is getting really dangerous. And that's when I started being diagnosed with all these things, which was really overwhelming. Not gonna lie, I was like, oh my gosh, am I like so weird? Like I don't fit in. Or what's wrong with me? And I thought a lot of different things, like I'll never find love, I'll never find a job. None of those were true, like at all. Um, and I've learned to live with it, to find the benefits of it. And by finding the benefits of my mental illnesses, I've been able to find success throughout my life.
Yeah, that's really interesting. I mean, you definitely have had a unique, like, I guess a unique way through life in terms of that, your life experiences and the way that you've got to where you are today. But I think that's a really important point to think that, the things that you think maybe, are that are really detrimental, they may feel true when you feel those really bad thoughts, but like you just said, they're not true. Like none of those things had to be true the way you thought them. and you were able to prove that to yourself. So I think that's really amazing.
Yeah, and thank you for sharing those things about yourself as well. Um, so to follow up, how do you approach balancing your life's responsibilities with your mental health?
So it's not always easy. Honestly, I think that, for example, I graduated a year ago, and September, almost, a year ago, I've been working full time, and it kind of hit me really hard, like what life was going to be like as a full time worker, not as an intern, not as a student, but someone who had to create relationships with people professionally and, deal with my mental health. And I've been pretty stable for a while, but I experienced certain things at work at the beginning that really impacted me a lot, and it led me to be in a very bad position. And something that never ever changed was me putting my mental health first, because something that I always keep in mind is, without mental health there is no us, and everybody has mental health, and we have to make sure that we're taking accountability of keeping that, well, because if not, nothing else works. So it's not perfect. I've accomplished a lot of things, but at the same time at work, I took a month off to take care of my mental health, which I was kind of scared of. But thankfully, where I work, and I wish this was the same case for a lot of other places, we have the ability to take time off if we need it, whether it's for burnout, for mental illness. It's a lot of things, and I was able to do that to take care of myself. Um, that was very helpful. But on a daily basis, like, I've dealt with things like having hypomanic episodes, and I'm like on top of the world and super excited. And obviously people can tell. So I'm like, oh my gosh, that's so embarrassing, like dealing with that. But it's part of life, it's who I am. And I'm very open about my mental illness, so people know. And I always tell people, like, let me know if you see me being a little too extreme on my emotions. um, and I think one of the things that affects me a lot is definitely intrusive thoughts at work. Like, I'll play back conversations in my head over and over, like, why did I say that? That was so stupid. Like, they're gonna hate me. I'm gonna get fired. Like, all this kind of stuff. Um, and I'm still learning how to deal with it. I think I'm messing up sometimes, and that's okay. I just have to give myself some grace and be like, you're human, and things like this happen. And I've through sharing my vulnerability with people at work, because I talk a lot about mental health at work, I've gotten people to share their own stories with me. And I cannot tell you the amount of people that I've met that have the same conditions or other conditions. And not only that, but at Google, we have groups for mood disorders, and a bunch of people like meet up and we talk about like our mental illnesses and medications and this and that. So all of those things, along with therapy, have really helped me, keep going at work and learn more about myself and learn how to manage all these feelings, emotions, and thoughts on a daily basis.
Yeah, absolutely. I think that that conversation about, bringing that mindset and approach to the workplace, is something that is totally not seen very often. I think there's a movement towards that, and I'm really happy that you're a part of that movement, because that's something that's, I think, really important to bring into the workforce. I know I'm approaching that in the future, and Jordy sure will be too. And so, these things are important to think about as we start working full time and have those responsibilities as people go from adolescents to young adults, students in college, etc. Whether it's whatever you're doing, eventually you kind of take on more responsibility in life, and you got to stand on your own 2 feet. And then it's scary to have those conversations or to be open even in a work environment. So I think that's something that's actually really stands out to me, that I think is very important, and I'm glad that you're being a pushing force for that.
Thank you.
Yeah, yeah, well said, Jake. Um, so now, which management and reduction techniques have you found to be the most useful for you in your daily life?
So I think therapy is definitely a big one. Therapy is so important. There's always something to work on. I think that like there are moments where, I'll go to therapy. There are moments that I won't. It kind of depends. But it's been such an important thing in my life to give me the resources and tools that I need to keep going. And there are different types of therapy. There's different types of like therapists, whatever. Everybody has different needs. But that's something that I've had on and off throughout my life, which has helped me. I think one of the ways that I've helped myself the most is by being open and honest with the people around me, because that's how I look for help. And I know that it can be scary to share this kind of stuff, but that's been kind of my survival. Like, for example, my husband is always there for me, and I like will tell him the craziest things, craziest thoughts, and he doesn't judge me. He just listens, sometimes doesn't even say anything. But that to me is like very helpful because I have somebody who won't judge me, who's just unconditionally there for me. So building that support system, whether it's like a partner or friendship or parents, whatever it is, it's super important because you need people there. Whenever we're not okay, those are the people that are gonna, help us get help, motivate us. Um, and that's been super helpful. And like I've kept saying, being honest with others, um, because I don't know, sometimes it can feel like we're misunderstood. And one of the ways I cope with that is by explaining these conditions, like saying, like, when I do this, it's because of this. And that kind of leads to more education towards people and hopefully less judgment because you never know what other people are going through. You never know, sometimes you may be like, oh, that person's acting a little weird. And turns out that they're having the biggest battle in their head. Um, and the worst feeling is feeling like people are judging you.
Right. Yeah. I think it sounds like, external, like you having those, relationships in your life that are supportive is seems to be, extremely important, because I think a lot of people, they like to look internally, and that's great, because internal is what you can control. But in terms of the relationships in your life, that may be the most important factor, potentially, in terms
Yeah.
of managing mental health concerns across the board. I think that's interesting, because I think I always will look internally before I look towards external things like relationships. I'll always try to think, what can I fix? But I think, surrounding yourself with people who are supportive is probably um, one of the most important things.
Everybody needs a little help sometimes.
Yeah, exactly. And you can do a lot more with help than you can by yourself.
Yeah.
Yeah, and it can be so difficult to open up to other people and be honest and vulnerable about these things. Um, and so hearing from you that that's what is something that's so helpful for you is definitely an inspiring message. Um, and yeah, so I know that you mentioned you have been talking to people at work, and you have this YouTube channel. So, what advice do you have for um, maybe beginning to help other people in around you who might be suffering from mental health concerns themselves?
So I think that the biggest, one of the biggest takeaways that I've taken from my therapist is that most people wear a mask throughout life and pretend that everything's okay and that their lives are perfect. Um, but whenever you're vulnerable with somebody, most of the times they take off that mask and are vulnerable back. So if you want somebody to open up to you, oftentimes what we have to do is open ourselves up to that person. And that's how, that's one of the biggest ways we can help by being vulnerable ourselves, because then we're more trusting and it's like we're more human rather than these like robots that have it all figured out. And I found that a lot. Through my YouTube channel, then I get like, me sharing my story. Then I have people messaging me, telling me their own stories, their own experiences, asking me for help. And I'm always like, I'm not a doctor. I can only talk from my own experiences. But having those conversations is so like, if it's so humbling, like it feels so good to have a human connection like that. At work, I've had the same thing. Like, I'm like, hi, my name's Victoria and I have bipolar disorder, like no shame. And then so I've had people who are like, oh my gosh, me too. And then, or like my parent does. And you start hearing these stories, but you would never know that about that person unless you yourself took the initiative to talk about it.
Absolutely. I think that's actually probably some of the best advice I've heard in terms of how to help others is like be vulnerable first and let people know that it's not just them, because I think that's the scariest part with mental health concerns is that you feel different, you feel maybe isolated, right? And that creates the vulnerability and the feeling that it's scary to share those things or to tell people that because you're going to be judged, right? There's all this societal pressure and the stigma around mental health. So I think that right there, what you just said was like really, actually, like, I feel like I connected to that in terms of if you want to get through to someone and try to help them, to try to, let them know that they're not the only one that has experienced those things. And that's, I think, the vulnerability, being vulnerable is, to help someone else and help them feel comfortable to also be vulnerable and then seek help is that's really powerful. I'm actually like, I really like that. Jordy, do you have any other thoughts?
I mean, I just really agree that that's very powerful stuff. And I feel like I just, the other day, I was having a conversation with one of my lifelong close friends, and it started with him asking me a question, and that I was able to open up to him about, and then that led to him talking about some of his own um, feelings and kind of deeper things. And we were saying, like, it's hard, like, these conversations don't happen too often, even though I've known him basically since I was in kindergarten. And yeah, just like it's really true how once you open up, other people might be more comfortable. Um, but yeah, I I don't have any other questions, Jake. I don't know if you have anything else, or we can wrap it up.
Yeah, we can wrap it up. So thank you, Victoria, for sharing all of that with us. The ways you learn to live with all those different signs and symptoms posed by mental health challenges are really inspiring. And we hope that someone listening can follow some of the same things that you did to gain relief and improve their situation. So thanks again for coming on and talking with us. It was a pleasure.
Thank you guys for having me and for starting this initiative. I really think it's inspiring to see um, like younger people. Not that I'm not young, but I'm like only 2 years older than you guys. But like, especially like at work, I've seen that like it was just intern season, and how many of the interns cared about mental health and how it
Mm.
resonated with them. It made me so hopeful because I've encountered a lot of like I've tried to make a difference, and sometimes older people are like, no, we can't do that, blah blah blah. So it makes me really hopeful that these new, I guess, Gen Z, who are starting to come more and more into the workforce, will make a big impact on mental health, and there will be more of us, and we can actually make a difference. So thank you guys for being a part of that and starting conversations that are so important.
Yeah, of course. That kind of leads into our next episode in this podcast, which is the future landscape of mental health. And we really hope that the future is shifting towards a more open conversation around the stigma of mental health and just people's mental health in general, bringing it into places like the workforce where it usually is shied away from. So I really like that. It's a great way to end this conversation. So thank you again for coming on.
Yeah, thank you so much.
That was an amazing conversation, and we really have some really important key takeaways that we can discuss here briefly. And the first one, Jordy, is the idea about bringing mental health into the workplace. I think Victoria outlined that like beautifully. I really liked the concept of talking about your mental health in the workplace, and getting people to open up as well, and creating that, very cultivating environment where it's a kind and open place. And I think that's something that we would want to continue to see in the workplace, and in the future, in to come. I think that's really important.
Definitely, yeah. I think mental health plays a huge role in workplace environment and in the work-life balance, and so like bringing conversations about mental health into work environments is a really positive step towards breaking down the stigma, and on top of that, one of the things I think we both found to be really insightful was talking about being vulnerable with others, both as a way to help yourself, but also as a way to connect with others who might be struggling with their own mental health. If you start out being vulnerable and open, it can encourage the people around you to do the same and to open up about themselves, and really just can help create a positive environment of acceptance and sharing. And yeah, I think that's really important and a really important takeaway. All right, so we'll now speak with Dr. Lara Latimer. She holds a master's and PhD in health education from the University of Texas at Austin, and she teaches from a holistic health perspective, focusing on personal health, including meditation and other stress management, reduction techniques, mental health, nutrition, etc.
Welcome, Dr. Latimer, to Minds and Memoirs. We want to thank you for the opportunity to speak with you, and we're really excited to dive into the topic of how people can find ways to manage their mental health concerns. Would you like to start by introducing yourself, telling us about your background, maybe your expertise and area of focus within the field of mental health?
Sure. Thank you, Jordy and Jake, for having me. I'm honored. I also appreciate that you're letting me introduce myself. I always find it awkward when people who don't know me at all try to read my my biography and have no context for it. So I'm happy to share. I would say the first thing that comes to mind when I think about like my area of focus, for mental health is my teaching. So I get a lot of interaction with students one-on-one and in the classroom. Mental health is first and foremost with most of what we talk about. Also more formally in the class I've been teaching for the longest, we spend 2 weeks very formally on mental health and stress reduction. And so every semester when I'm kind of refreshing my materials, I'm focusing on like what's the newest stuff that we need to talk about and what are kind of tried and true techniques that we can use to address our mental health and stress. And so I'm always kind of trying to revamp that and stay on top of the latest with that. And then that theme carries out into content for the whole semester. Mental health is a personal interest of mine. So in my leisure time, a lot of the time I'm reading or listening to things that are related to mental health. Always trying to learn more just because I have a personal interest in that. I have a personal interest and practice in mindfulness and meditation, which also crosses over into my teaching and really into all parts of my life. I teach a lot of my students in one particular class how to meditate, and we meditate together at the beginning of every class for the whole semester. I have some graduate training in the area in the sense that all of my graduate training was in health behavior change. And so that's helping people behave in ways that support their physical and their mental well-being, how to get them to change their behavior in a way that supports that. And then probably finally, the thing that comes to mind is working with my clients in my life coaching practice. So I work with people one-on-one to help them develop new perspectives and skills to live happier and more fulfilled lives. So that's a lot of work on our minds in that arena.
Wow, that is a lot going on for you, but that's super all exciting and that's all like a lot of, helpful stuff, for the community, and I especially like the meditation part that you meditate before the start of each class for that class that you teach.
Yeah.
That's actually really interesting. I think more teachers could implement that just in general across the board.
Right?
That would be really interesting. So going into our first question, how does someone begin to address their personal health if they feel overwhelmed or stressed out? And maybe what are some of the most effective ways to manage all that?
Sure. I think most people feel overwhelmed and stressed out when they think about trying to address their personal health. Rarely does a person have one thing that they want to address with their health. And I think that makes sense because we are, multifaceted beings. And so I don't have a lot of sexy answers for you, but I think the number one thing to do is to start small. And people don't do that because it's not sexy. Those are not the clickbait things that you see online, right? That's all very extreme and some overhaul thing. And to use meditation as an example, I try to, I talk to my students about meditating, or I'll talk to life coaching clients about meditating. And my suggestion is to start with 1 or 2 minutes a day. And instead of jumping to, okay, I'm going to start meditating, let me go do a 10-day silent retreat. That's the thing that people want to do so they can have a badge of honor or feel like they're really immersed in it. And I think that's probably one of the biggest mistakes people make is starting too big. And then coupled with that is trying to do too many things at once. So it's our tendency to really want to just let's just dive in. I'm going to do all the things related to my health all at once. They all need to be addressed. And in a previous iteration of my primary class that I teach, we used to do a behavior change over the course of the semester. And that was always really hard to get students to focus in to pick one thing. And so we would just talk about look, you don't have to mark all the other things off your list. We're just going to put them on the shelf over here for a little bit and focus on this one thing for now. You're going to learn things with this one behavior or change that you want to make that will help you in the other ones. So you don't have to give up on them, but just not trying to tackle everything at once, which is counterintuitive for people. And maybe intuitive isn't the right word, but they want to feel better, and so they just want to change all the things at once because they want to feel better. Doing something. So there's a lot of overthinking that happens. Oftentimes the answer is less thinking, more doing. I think remembering that there's no one right answer, no one right way to do things can help us, because when we think that there is a right answer, then we get bogged down in trying to figure out what that right answer is. And then we just stay stagnant or kind of, go in a circular motion. So remembering there's no one right way to do it, just start, gather some information, reevaluate. We need to intervene on our current thoughts. So our current thoughts are what got us in the situation we're in now, and we want something different for ourselves, right? So we have to intervene on the thoughts that have been driving our behavior so far. You could do this in many different ways. You could try to work with a professional, whether that's a therapist or a coach of some sort. Your professors potentially could help you with that. You could rely on a support system if they are healthy and have done some of that work themselves. And then you could also just help yourself. Any individual could help themselves by journaling some of your thoughts so that you can look at them a bit more objectively. If you can see them on a page, that can help people sometimes. Minimizing distraction is another way to help. So we have a lot of ways that we distract ourselves, usually when we're uncomfortable with something. If we can minimize that, which meditation does help a lot with that, we can actually have some momentum to move and some space to move. When we're really distracted, things kind of get constricted. And then I think finally, making sure that we're combating the inner critic. And this might kind of piggyback on that intervening on our current thoughts type of thing, because if your current thoughts are overly negative, if you have a view that you're in some way deficient, we have to combat that inner critic in order to help us move. That also tends to be difficult for people to do because they think that if they are and I think that the inner critic is what's going to help them get somewhere. Like if I'm just hard enough on myself, then I'll finally act and get myself off the couch and do that 5K or whatever. Except that that's what people have been doing, and it doesn't seem to be working, not in any sustainable way. So I would argue that, what if you just tried something different and tried to combat the inner critic? One of the things that comes up when I talk to students, for example, about combating this inner critic is that it can oftentimes feel fake. So if I have, let's just say, for example, if I struggle with body image issues and I am overly focused on one part of my body, like let's say I criticize my stomach a lot and I feel like my stomach is fat, and I think if I criticize myself enough that will motivate me to exercise more, for example. If I am going to try to combat that inner critic with the complete opposite type of thought and say, my stomach is awesome. I love my stomach. It's amazing. It's perfect. There's a part of me, probably most of me, that doesn't believe that, right? Because I believe the other thing that I've been believing for this long. So when we combat the inner critic, we have to choose new thoughts that we actually believe, not just any other positive. We can't be Pollyanna about it and expect that it's going to work for us all the time. So a good example of this is just sometimes we have to get really neutral to combat the negative inner critic. So in that example, I might start and continue this way for as long as I need to and say, I have a stomach. Because we can't refute that, right? Like that's going to hold up in a court of law. That's an objective fact. Whether it's big or small or flat or wobbly, bubbly or whatever is a matter of opinion. And I'm trying to pick some new thought that I believe. So it may take me some time to get there before I realize it's okay. I'm okay with it. So I'm just going to just acknowledge the neutral objective fact until I can get on board with a more positive thing that I actually believe.
That makes a lot of sense. That was a lot. And I think some of the things that stood out to me were the idea of planning too much. I always over plan and kind of dive into that, researching online. And there's so much information these days where you can really be overloaded with information to the point where you're being told how to fix your problems in 30 different ways. And you can go down rabbit holes, and each way kind of debunks the other at times. And I feel like my personal problem is I'll spend a lot of time planning in my head that nothing actually ever materializes. That idea that you brought up of picking one thing and just starting out with something small and doing that one thing could be a really effective tool that people could use. And also I liked the thing that you said about sustainability, trying to go for options that are sustainable. I oftentimes find myself doing that hard, pushing myself too hard, trying to do too much, and then clearly it's not sustainable. So I feel I related to any of those. Jordy, I don't know if you have anything to say about that.
Yeah, I've really liked what you had to say about changing your approach to life mentally, or the way you view yourself or the way you view your problems and actions. Because I feel like, at least when I was researching this topic and looking into it, I was thinking a lot in terms of what actions can you take, can you meditate or go exercise or eat healthy? But the mental, your outlook and the way you think about things is just as important. So I found that very insightful. And
I agree.
So to contrast that last question a little bit, what about some maybe not so beneficial ways or mistakes people might make when trying to relieve stress or manage their mental health challenges?
Yeah, I mean, the list is endless. It's endless. I think when the first thing that comes to mind when I think about this question is the distraction piece. Ways in which we distract ourselves. Technology, TV, social media, smartphones, all of that stuff. Alcohol, drama, trying to change too many things at once. That's really one big distraction, right? It makes it to where we can't stay focused. It's a huge distraction. Um, Jake, when I hear you talk about going down the internet rabbit hole with things, like that's so,
Yeah.
I feel that. And I think it's some flavor of thinking there's a right answer when there isn't really one right answer, right? And so all of those things they just distract us. So trying too many things at once, overworking, or just generally staying busy is a huge distraction, and it is not helpful for our mental health or minimizing our stress. And then kind of on a like a broader level, when I kind of pan out a bit and think about big picture, um, in general, thinking that there's something wrong with ourselves that needs to be fixed. That's a really problematic place to work from. When we are working from a place where we think there's a deficit that needs to be corrected, it's impossible to help ourselves in any kind of constructive or sustainable way. Even when we have maladaptive coping mechanisms, and so we could maybe easily be like, oh my God, there's something wrong with me because I don't cope with these things well. Okay, so let's just assume like, yeah, maybe I drink too much. Maybe I like am drawn to drama or whatever. I have maladaptive coping mechanisms. They likely helped us at some point because those things work until they don't anymore. And so even when we approach ourselves from that place, we need to recognize like, I don't have maladaptive coping mechanisms because there's something wrong with me. I have these because I needed them at some point in time and they actually helped me. They may not be helping me anymore. Maybe they're not serving me anymore for these other goals that I have. And so what I just described to you is taking this stance of self-compassion, which is really difficult for people to do because it sounds mushy and soft and wimpy and like self-indulgent, self-pitying, and just like, what, that's not going to help me make any moves on, goals that I have. And yet it's where a lot of your power can come from if we can just like acknowledge things in a softer and a kinder and neutral, if you can't get to kind, but even neutral helps, right? Rather than negative and deficient. So yeah, just like getting away from thinking there's something wrong with me and it needs to be fixed. That's a big problem I see with individuals.
I mean, yeah, the list is endless, right? Of like harmful coping things, but I like that outlook that it might be harmful to you now, but like you started doing it for a reason. Yeah, kind of putting the positive spin on things.
Right? But not,
Okay, so
sorry, I wanted to just point out something real quick,
no, yeah,
but not in
go
a
ahead.
fake way, right? Like that's a really good example of like this kind of Pollyanna, which that might be an outdated term for y'all. That's a really old movie where she's just like always happy no matter what. But it's a genuine way of being, and it's kind, and yeah, it is somewhat positive, versus just beating up on ourselves, but not in a fake way where I'm like, everything's fine, I'm fine, everything's fine, everything I do is fine, there's no problem. That's not really sincere. But there's like somewhere in the middle, right? So we might not want to be like, that's not always helpful, but then just beating ourselves up is not helpful. And so if we can get more in the middle where we're acknowledging that, yeah, I may have some work I want to do or some things I want to change, but these things served a purpose at one point in time. And like, there's nothing wrong with me that I depended on them is more realistic, I think.
Yeah, definitely. So earlier you mentioned that you focus like holistically on mental health and personal health. So how does nutrition specifically factor into the mental health equation, and can good nutrition be used as a way to improve your personal mental health?
Yes, I'm glad that you picked up on that as well, because the first thing that comes to mind for me when you ask about this is how can we think about this from a holistic health paradigm? So of course, if we take it from that standpoint, nutrition is a part of that. It can support multiple dimensions of wellness. I have my own personal views on food, just things like eating whole foods or minimally processed foods as much as possible. And then, of course, we could get down in the weeds as to like, what does processed mean and everyone's definition of that. But, I have my own personal views on that. Other personal views for me are like not adhering to anything that's overly restrictive or rigid. Drinking lots of water, minimizing alcohol, cooking and eating at home on a regular basis, things like that, again, not sexy, right? Nobody's selling that. You're not going to click on that online. But the flip side of that, I will say, I think sometimes people get caught up in the nutrition aspect of things. And when I say that, I mean dieting, like toxic diet culture. And I think it's helpful to to consider what all that might encompass. So not just cutting calories necessarily or like watching fat grams or things like that, but things that kind of sneak in that they're really diets because they are restrictive in some way and usually not meant to be done long term. Things like eating clean, being gluten-free when you're not celiac, keto, vegan, like all of these things oftentimes are representative of a kind of toxic dieting culture. And I think it's important to point out, I don't think, or I'll just speak in the positive. The reason I think that can be problematic is because when we think about from a mental health standpoint, to go back to your original question, none of those things, no diet and no, complete focus on nutrition will ever replace giving attention to our mental health in constructive ways, like fully expressing our emotions instead of pushing them down or overly identifying with them. Practicing presence, practicing self-compassion, practicing self-acceptance. So yes, I may focus on nutrition, but sometimes I think people they go down a rabbit hole, right, on the internet, or they buy a book and some supplements or whatever. And there's too much of a focus on that. And no, you could have the most optimal nutrition of anyone, and it will not replace the other things that I listed that are getting directly at our mental health and affect our stress. They affect our connection with other people, our connection with ourselves, etc.
That makes sense. So it almost sounds like it's one part of the equation, but it's definitely not like the core solution. Like if people had to turn to one thing, nutrition's great and you probably should have good nutrition, like the things you said, but it's probably not going to solve the problems. Like it's not the core, it's not solving the root issue. So that's good to point out. And I know for a fact, like when I talked about going down the rabbit hole in the internet and kind of things canceling each other out, saying this is better, no, this is better. I think diet and like those diets, like keto versus paleo versus carnivore, all the different diets, like those are the ones that always, they always fight within their communities about, which one is solving, which problem or which one's better. And I think also the way to approach it is it's kind of a different, each, like maybe one diet might affect someone differently than another diet. So it's obviously very personalized. And I think that's one core theme within, mental health reduction and techniques to mitigate those concerns is like, it has to be personalized to you. It has to be sustainable to you. I think that's one big thing. We talked about sustainability, but it needs to be, a multi-factored kind of approach where, you do one thing at a time and you don't do it all at once, but it has to be personalized to you in order for it to be effective. So I think that actually makes a lot of sense.
Yeah. And I will say from a kind of personal and academic standpoint, in graduate school, I focused a lot on obesity treatment and prevention, specifically as it related to nutrition behaviors. That's what I did for basically my 6 years of graduate school and a year of my postdoc. And before that, my undergraduate degree was in kinesiology. And so I was more focused on like movement and exercise and always seeking, for a way to feel better and to like kind of embrace whole health. And I found those to be dead ends for me at some point. Like I realized that, I might feel better for a little bit, but then it was like it didn't work anymore, and I had to find another new diet or another new exercise program, or I had to beat up on myself some more to get myself to do those things. And I think that's why I really shifted. The shift happened a lot in my postdoc, which was between 2013 and 2014, to more of this interest and focus on mental health that I bring a lot into my teaching now. Because I realized like it spans everything. It's driving, what you do with your nutrition to some extent, and what you do with your exercise to some extent, and things like that. So I've just, for me, found that it's more rewarding in a lot of ways.
That, yeah, makes sense. I think we had that last question, but we got so much content here, so much good content.
Okay.
I'm willing to, I wrote it as bonus question, so I'm willing to say we don't have to go over it unless you had something particularly that you wanted to say about it.
It's short. Yeah. The thing that came to mind whenever I read this, because I think it's important for so many of my students, they want to help other people. Like they're either like pre-PT, pre-OT, pre-med. They're personal trainers already. They're going to be future teachers. Like they want to help people. So I think this is really important, actually.
Okay. Yeah.
But I have a pretty succinct answer, and that is common mistakes. I think the biggest mistake that we make is not listening. We're trying to jump in and fix things because of our own discomfort. Either like we have a personal discomfort with whatever the person's talking about, or we're uncomfortable with seeing them uncomfortable. And so if we can just be more, like practice being humans more, where we're just being and we're listening and we're making eye contact and we're basically being present for somebody, it can go a long way. We don't have to have any answers. Giving somebody your full attention is one of the most loving things that we can do in life. So
that's a great answer and a great way to end this. So thank you, Dr. Latimer, for answering these questions and taking some time to share, your knowledge and expertise with all of us. There's a lot of valuable information said here, and we really think that anyone who can implement, one or two of these techniques or just ideas that we've talked about within their daily or weekly routine could probably benefit, a lot. So thank you again for coming on the podcast. We really appreciate it. And yeah.
Yeah. Okay. Thank you so much for having me. I appreciate it.
That was an amazing conversation with Dr. Latimer. I really liked all that she had to say. And some of the things that stood out to me were, approaching one thing at a time in terms of trying to, reduce or manage some of your mental health concerns. Basically, the idea is to start small and not to try to do too much at once. I think that is a really key, important aspect that people can implement when they begin to try to manage and reduce their stress or other mental health concerns. Another takeaway was that there's really no one-size-fits-all solution. So for every person, you have to tailor your approach, and that means maybe trying different things and not sticking to, all the different things online that say you have to do this or this is the only option or, this is the best option. There really is no best option. It's kind of what works best for you. Lastly, I think another takeaway would be, the meditation time. I know Dr. Latimer implements the meditation within all of her classes that she teaches. And I think the idea is that taking a moment during the day of the busyness and everything that's going on to just sit with your thoughts and kind of have a moment to be calm and relax. I think that's a very important takeaway that people can start to implement, start to do meditation to try to help their mental health concerns and reduce stress.
Yeah, incorporating mindfulness and taking moments throughout the days to address your own mental health can work wonders for your daily moods. And I think it's amazing that she leads meditation with her classes. I think if I was a student in her class, I would love that personally.
Yeah, definitely. Moving on, for our final guest of the episode is Dr. Brent Turnipseed, a board-certified psychiatrist and the co-founder of Roots Behavioral Health based out of Austin, Texas. His practice aspires to create a new, person-centric model of behavioral health care, one that regards patients as whole human beings and not just a cluster of facts or symptoms.
Welcome, Dr. Turnipseed, to the podcast. We are excited to speak with you and discuss potential solutions for mental health concerns that do maybe more than just mitigate symptoms at best, maybe rather solutions that hope to address the core causes of mental health conditions. So thank you for coming on and speaking with us.
Thank you, Jake and Jordy. I appreciate it. I'm honored to be here.
So tell us about your experience and your area of focus within the field of mental health.
Yeah, sure, you bet. So I'm a board certified psychiatrist, certified in adult psychiatry, and for that specialty, we're trained as generalists. So we treat just about every common or major condition in the field of psychiatry, and again, just adults. So we treat people from ages 18 to 65, roughly, and so that's like the basic setup. Now, however, about 4 or 5 years ago, I brought ketamine and ketamine with psychotherapy to our clinic. It was kind of a breakthrough treatment at the time. And so, we found that it was really effective for our patients, and it was kind of cutting edge and exciting to learn more about ketamine. And so suddenly, me and my colleagues at Roots Behavioral Health kind of found ourselves becoming experts in ketamine. Ketamine is also considered to be a psychedelic substance. We can talk more about that if you like. And because of that, suddenly we found ourselves kind of pulled into the world and the research world of therapeutic psychedelics, which is kind of a hot topic in our field. And there will probably be more psychedelic treatments coming down the pipeline the next few years that are FDA approved and legal. And we've also kind of gotten a little bit of interest and expertise in using and prescribing medical cannabis. Texas has a very limited, but it does have a medical cannabis program. And so because of this focus on ketamine and psychedelics, if you treat patients with ketamine, you typically are going to be seeing a lot of people with severe depression, refractory depression, and refractory other mood conditions, especially PTSD and OCD. So because of all that, that's kind of become our area of focus and expertise at Roots, is treating difficult to treat conditions, things that often don't respond to standard treatments.
Yeah. Okay. That's awesome. We'll definitely get into some of the psychedelics and some talking about that later on, because we find that really interesting and we'd be curious to find out more about that. But for a little more baseline, higher level, how would you describe the connection between someone's physical body and their mental health?
Yeah, it's a good question because it kind of ties into like a change that's kind of ongoing in our field right now. So, first I'll say, to me, like the idea that the two are separate, physical health and mental health, is kind of silly if you think about it, because mental health implies brain health. And the brain, of course, being a physical organ, also implies that mental health is actually physical health too. So I think we kind of need to reconceptualize like how we think about this. And like I said, traditionally there's been a separation. So it's like the brain and the brain health was completely independent of the rest of the body, which doesn't make sense at all. And I can explain why. And so now we kind of have gotten to an understanding, and when I say we, like most people in our field, in psychiatry and just in medicine in general. And so we understand that, lots of people are walking around with chronic health problems. And so some common things might be that come to mind, like obesity, which is common. Most American adults are overweight or obese right now. So people with obesity, high cholesterol, heart disease, diabetes, autoimmune conditions, there's many more examples. But those sorts of chronic health problems tend to lead to some sort of chronic systemic inflammation. So when I say systemic inflammation, I mean like our immune system is producing these pro-inflammatory molecules, and they're circulating, through our body, through our bloodstream. And they can cause harm and they can cause damage. And some of those chemicals find their way to the brain. And so these sorts of chronic conditions through that mechanism, and there's many others, but I just wanted to mention inflammation as one example, that, this kind of chronic inflammation can predispose a person to having poor brain health and having a greater chance of something like depression. So it's important to consider other health problems apart from the brain to kind of better understand if they might be contributing to, problems with mental health or brain health in general, if that all makes sense.
Yeah, I think so. I think that's it's a great thing to point out, because I've always felt
the mental health and the physical health are pretty directly connected. Whenever one thing goes, the other thing starts to go as well. So they seem definitely linked. And then in terms of this, the episode and the content of this episode, we're really curious about how do people address mental health? How do they solve mental health? And so, how would you go about, or how does one person go about addressing, solving the root cause of their mental health concern or multiple causes?
Yeah, so the way I was trained in my psychiatry residency, which wasn't that long ago, we're talking like 10, 12 years ago, we were taught and trained to assess people just kind of an ordinary physical exam and medical exam and psychiatric history exam. And that's okay, and you get some good information there, but it doesn't dig deep enough to really talk about how do you view this kind of whole brain and whole body picture to figure out what's contributing or maybe leading to what. And so which is to say, now I think we're realizing we need to approach how we evaluate and assess patients differently, and probably with a little bit more depth and complexity. And so, for example, at Roots Behavioral Health at our clinic, we've kind of created a protocol and a whole way to see and view and talk to patients about what brings them in. So we're going to assess a variety of contributing factors. And so big things that really stand out, in addition to just asking about a person's medical and psychiatric history, we're going to ask them about their diet. And I would say diet might be one of the most important modifiable risk factors for brain health, but general health or healthcare or your health in general. I mean, much is determined by what you eat. So we're going to look at a person's diet. We're going to look at if they're exercising or doing any kind of physical activity or lack of. We're going to look at any contributing medical conditions, like I kind of mentioned, to see if they have something that we think might be contributing to, let's say, their depression that they're seeing us for. We're going to look at whether or not they have a substance use problem, alcohol or other substances that might be contributing or worsening their brain health. We're going to consider psychological factors. That can be a lot of things, from the way a person was brought up and raised by their family or parents, to whether or not they experienced trauma at any point in their life, what their relationships are like with, people in their life, coworkers, family, friends, loved ones, that sort of thing. And then we're also going to do and recommend thorough lab screening to kind of assess, a long list of biomarkers that may give clues to factors leading to poor brain health. So I won't try to get too technical, but to give you an idea, routine labs typically involve a blood count and what's called a metabolic panel. And that's common. That doesn't often tell you a lot about brain health, but we're also going to check thyroid function. We're going to look at B vitamins to see if they have a normal level of B12 or folate, both of which are super important to brain health function. We're going to look at a couple of common inflammation markers in the brain so we can figure out, do they have inflammation? We'll check vitamin D. Those are some of the big ones. There's a few other things we can check. And then, in addition to all those things, the last thing, which has become more prominent in the last few years, and I'm one of the few people that seems to be spearheading this, is we really want to talk to patients about what their relationship is like with technology, how much screen time they're using a day, how much, if any, social media they're using. Because we're finding that, for the most part, excess screen time and social media doesn't really offer anyone a benefit to their, overall well-being or health. And if anything, the more social media and the more screen time a person uses, typically they feel worse about themselves. Sad, but true. So we ask people about that, and strikingly, a vast majority of patients admit that they use too much social media and screen time, and they often say they wish they could use less. So all those factors kind of, allows us to assess what might be root causes to why they're coming in the first place.
Yeah. We have been doing some research on the connection between social media and technology, and people's mental health, because it's, especially people in the younger population, it's such a big part of our lives. And yeah, and I also find it very interesting the way you talk about the brain mind interaction. I've taken some philosophy classes where a big discussion is like, is the mind separate from the body, separate from the physical brain? And it's interesting that in the mental health field, there isn't really that much of that debate, or it's a lot more on the side of they're connected.
If I could add, can I add something to what I just said real quick?
Yeah, please.
Yeah, go for it.
If y'all or your listeners are interested, I can kind of plug a book that just came out. I would strongly recommend if anyone's interested in this idea about mental health and technology. There's a book that just came out, I think in the last couple of months, called Stolen Focus. And it's written by Johan Hari, who also wrote a really good book called Chasing the Scream, which is about the war on drugs and how it's kind of pointless and really just harmful to society. And so in Stolen Focus, he talks about, Western civilization primarily, and our relationship with technology and how harmful it is, and how no one can hold attention span at all anymore. And you see this, if you're really paying attention for it and watching for it, you can see this everywhere you go all the time. People are perpetually distracted and they never get into deep work or deep focus. And it's bad for us and it's harming our society. And on top of that, it tends to polarize us more. And we're living in this time where, no one likes each other or anybody. Everyone's kind of separates into their political and whatever tribes. And, I grew up in the 70s and 80s, and I guess that's maybe it seems like an old person at this point, but it's like, gosh, we didn't have this until just the last 10, 15 years. And I think technology has a big part to do with that. So anyway, Stolen Focus is a great way to kind of help you wake up to like, oh, this is what's happening to us right now, and to become more self-aware of people's like use of how they utilize technology. And he gives you some very practical step-by-step things you can do to kind of put those guardrails and boundaries up so you're not dominated and distracted by technology all the time.
Oh yeah, and that's a new book, right? That just came out this year.
Just came out a few months ago.
2022. That's interesting. Yeah, it looks really good. It has really good reviews online. So
yeah, you'll read it or do audiobook, and halfway through you'll hear some scathing things about Meta and Facebook, and you're just like, wow, people need to read this. And need to wake up to the fact that, it sounds kind of silly, but if you go back and think about the movie Matrix, when the Matrix came out, we thought, this is fantasy, this is sci-fi, right? And yet you read this book and you realize, oh, we're actually, our society is plugged into the Matrix already, and people need to wake up and realize that. It sounds radical and crazy, but you read the book and you'll see what he's talking about.
No, absolutely. I feel like I have an idea of what you're talking about. That's really interesting.
Yeah, really interesting. Thanks for that. Okay, and so touching back on what you mentioned earlier about psychedelics, so besides the fact that in psychedelic assisted therapy, psychedelic substances are involved, what sets it apart from standard psychotherapy practices?
Yeah, so that's a good question. Although it's almost, for me, it feels impossible to answer the question without talking about it through the lens of the psychedelic portion of the therapy. So I'll try to explain. So, traditionally in psychiatry or in the mental health field, traditionally we separate a medical treatment from psychotherapy. So if someone comes in and they need help for depression, their psychiatrist might prescribe Prozac, and they might refer them to go see a psychotherapist, at a separate time, at a separate place, right? Maybe in the same office, but the two are still separate. So with psychedelic assisted psychotherapy, suddenly you have this paradigm is completely blown up and changed. And you have the person experiencing psychotherapy while they've also taken a substance which alters their waking consciousness. And so when you kind of shake up and alter this waking consciousness, for some people, this can kind of open a window into an aspect of a person's mind, their memories, fears, behavioral patterns, etc. And that window may give the therapist and the patient an opportunity to kind of work through issues or material that they normally can't access in standard psychotherapy. And I'm not saying that psychedelic psychotherapy is necessarily superior to other psychotherapy. It's not. It's just a different way of doing things. And I say that because when when this topic comes up, and I have a lot of friends and colleagues that are psychotherapists, there's kind of a defensive feeling like, does this mean we're not relevant anymore? And absolutely not. It's just a different way to approach treatment. So, so that's one thing that's unique about it. And how the work actually goes down in the sessions. Psychotherapists typically have learned from like a variety of different psychotherapy schools and paradigms. And so they're often kind of blend or make a hybrid of those, and they'll use kind of whatever fits the best needs of their patient in the moment at the time of the psychotherapy. So they might blend styles of schools of thought from things like supportive psychotherapy, psychodynamic psychotherapy, even specific techniques like EMDR, which is a type of therapy used to help people that have PTSD. One other unique thing that kind of comes to mind is this concept called integration. So if a person does a psychedelic psychotherapy session like ketamine, like we do in our clinic with psychotherapy, you've got this session. Well, you want patients to meet with the therapist at a point afterwards, when their consciousness is not altered, when they're sober, and usually within a week of the psychedelic session. And the idea of integration is kind of what you think based on the meaning of the word. It's the therapist and the person taking that experience and sort of putting those pieces back together afterwards to kind of make sense of what it all means and how is this relevant to my life and my experience.
Yeah, that's I think the idea of introducing psychedelics into a therapy is really it's got to be, maybe they've done it in the past, but it feels like pretty controversial. Like it could be controversial. A lot of people would be against that, but I definitely think it's an approach that's unique, innovative, creative, and I'm guessing it's quite useful and effective. Is that something that you found?
Yeah, I mean, for some people, it's a game changer, and they experience improvement or positive changes in their life that they say they've never experienced before, or that they've never had this much of a dramatic change or improvement, as long as they've been in, mental health treatment. That being said, it doesn't work for everybody. No treatment works for 100% of people. And, I try to convey and teach our providers at our clinic to, really impress that upon patients, that we want to give people hope. I mean, we want to talk about options and, innovative and exciting things that might help them. And yet, it's not a guarantee. Sometimes it doesn't work, but fortunately we have a lot of other things we can talk to them about, other options they can try. There's many things we can try and recommend that often many other providers out there just don't think to suggest. So we enjoy thinking outside the box at Roots.
Mm-hmm. Yeah, and that kind of leads into the next question, which is, what inspired you to take such a unique, holistic approach to mental health care?
Yeah, I was thinking about this question because when I first finished training, I just wanted to learn how to, be a good doctor, be a good psychiatrist to my patients, and just kind of learn my craft. And I wasn't thinking about this holistic approach at all. It wasn't on my radar. I just wanted to be competent and good for my patients and the community. But after several years, I think one thing that sort of inspired this approach was, for myself and, many like-minded colleagues, after years of seeing thousands of patients, you start to notice, you notice daily, that the work we do, there's limitations in the medications and the therapies we recommend to patients, meaning like they don't work for everybody. Many people never experience adequate relief from whatever they come to see us for, especially things like depression. And then we added ketamine at our clinic 4 years ago. And I began to notice that post-ketamine treatments, many patients, suddenly seem to have this unique sense of purpose and motivation that you normally don't see in people being treated for depression. And if they had experienced that before, it might have been slower and it might have been a much longer process. But with ketamine, sometimes it's quick and dramatic. So suddenly you've got patients that have this like desire to be much more healthy, which is nice, right? And it seems like there's this window of opportunity for them to get better, and we want to take advantage of that in a way to give our patients the best chance at long-lasting improvement in their overall health, including brain health.
Yeah, that's really interesting. It's kind of like when you get a burst of motivation in life, it's really nice to actually take that motivation and do something with it, because it's not always there. So that's a really interesting thing. Actually, I feel like that makes a lot of sense, that you'd want to take advantage of those moments when there's like a breakthrough, because they may not last.
Yeah, and actually, there's a large organization that funds and kind of promotes therapeutic psychedelics. It's called MAPS. It stands for Multidisciplinary Association for Psychedelic Studies. And they're having a very large conference in Denver next year in summer of 2023. And my wife's our executive director. We applied to speak. And one of the topics we proposed to speak about kind of ties in with this question right here. We want to talk about what's so unique about psychedelics and how they, are this great leverage to affect long-lasting change in people's health in ways that nothing else in our field's ever done before. So to me, this is like a really exciting topic and question, and I think the ideas need to be fleshed out more. And hopefully, we can speak to a large audience, about this idea next year.
Yeah, more people need to hear it. This is really interesting. All right, Jordy, you can take it away with the last question.
Yeah. So I know we've talked about kind of the ways that you can help people in the positive ways, but what are some common mistakes that you see that people make when trying to help themselves or trying to help others suffering from a mental health problem?
I think one common mistake, and mental health professionals, mental health providers can kind of make this mistake too. And this is one thing I've learned the longer I've been in my career, is you need to learn to meet people where they're at. So if you tell people, let's just say patients suffering from depression, for example, if you just tell or dictate to them what they need to do, kind of in a paternalistic way, which is how medicine and healthcare was for a long time. I think that vibe was still kind of there even when I went to medical school. So if you do that, if you kind of dictate and tell people what they need to do to get better, it seems like there's a natural human tendency to resist that. People don't like being ordered around. People don't like being told what to do. Now, most need advice and help, right? And they come to us for solutions, but you have to walk a fine line and allow people to make their own choices. But of course, we're still giving guidance, support, and education. We're trying to guide them to what we think is the best thing they should do. But it's more likely to work, and they're more likely to do it and stick with it if they kind of come to that decision on their own. So I don't know if I kind of explained that answer well enough or not, but I think that is one of the most important tenets of good bedside manner in psychiatry. And I try to teach and impress that upon all our providers at Roots. I'm our medical director, so I feel responsible for all our providers that see our patients. And this is one of the most important things I tell them is, people might make bad decisions. Their judgment might not be great. They might be living in an unhealthy way. But if you just shame them or order them what to do, they might need it ultimately, but that's not how you get someone to make a change. They've got to make that decision on their own.
Yeah, that makes a lot of sense. I think that touches into just, human behavior, as it is. It's going to be a weird comparison, but you see that with children. If you try to get a child to do something and you try to force them, they may not want to do it. But if you convince them that it was their idea, then all of a sudden, they're doing it, and you had to put in way less effort to get them to do it. So it's a weird comparison. Right. But
That's right. I have two young kids. I have a 4 and a 7-year-old, both of whom go to a Montessori school. I went to a Montessori school. And, one of the most important ideas in Montessori is you follow what the child's doing. You kind of guide and help them, but you follow them. And we're all not necessarily like children, but that principle holds true even with helping people who are suffering too. You want to follow where they're going and where they're taking you and leading you. You don't want to just tell them what to do, because yes, kids are the same way. You dictate and bark in orders to kids, like they might need it, but ultimately kids protest. I'm like, no, I'm not going to do this. No, heck no, never, right? So yes, you're right.
Yeah, I just thought of that, and yeah, it's just human behavior, I think, to want to believe that you came up with the idea that, or made the decision that you did. So yeah, thank you. I think that wraps it up. Thank you again, Dr. Turnipseed, for coming on and discussing with us. We deeply appreciate your time and insights into mental health and tackling root causes. Exploring these solutions and sharing them with the world is super crucial. So thank you, and we hope that you enjoyed coming on the podcast.
I did. No, my pleasure, Jordy and Jake. Thank you for having me.
Yeah, of course. It's been great. Thank you.
So that was a great conversation with Dr. T. A few key takeaways. This idea of ketamine therapy and using psychedelics in combination with psychotherapy techniques is really compelling and a really interesting line of research. Another takeaway is that there isn't one solution that works for everyone. So Dr. T emphasized how they have a wide range of techniques. If, for example, ketamine psychotherapy isn't working out to help someone's symptoms, they might try something different, like a different form of therapy or maybe medication. But there could be another patient with the same exact diagnosis, and ketamine psychotherapy works wonders. And that's just the nature of mental health treatment. So, to conclude, in this episode of the Minds and Memoirs podcast, we talked about some ways to help yourself and ways to help others when facing mental health concerns.
In the next episode, we change the speed and talk about the future landscape of mental health, including trends, technologies, and promising startups. A truly unique and final episode of the Minds and Memoirs podcast that you won't want to miss.
Check out our website, mindsandmemoirs.com, to stay up to date and find more information.